Dear students, let us learn about the rotator cuff of shoulder. The rotator cuff is a strong fibro-musculo-tendinous covering around the glenohumeral or shoulder joint. So, there is a fibrous component, a muscular component and tendinous component in the rotator cuff of the shoulder. It is formed by tendons of 4 muscles that will become flattened as they are coming towards the shoulder joint, and they will join with one another by their edges, and they also fuse with the fibrous capsule of the shoulder joint. So, there are 4 tendons of muscles that are contributing for the rotator cuff of shoulder joint. In this picture, you can see those muscles on the dorsal aspect or the supraspinatus, infraspinatus and teres minor. On the anterior aspect, you are seeing the subscapularis muscle and its tendon. In this picture, you can see the capsular ligament of the shoulder joint. It is cut around the glenoid fossa. So the importance of this rotator cuff of shoulder is it protects the shoulder joint, gives strength and stabilizes the shoulder joint. It grasps the head of humerus and holds it against the shallow glenoid fossa. The rotator cuff is also known as musculotendinous cuff or sits cuff. So why it is called sits cuff is it is formed by the blending of the 4 tendons with the capsule of shoulder joint. The 4 tendons are the supraspinatus superiorly, the infraspinatus and teres minor behind, and subscapularis in front. So, they have got that name of sits cuff because of the formation by these 4 tendons. And there is no extension of the rotator cuff onto the inferior aspect of the joint. Hence, it is more prone for dislocation in the inferior direction. In this picture, you can see the rotator cuff muscles. They are the subscapularis anteriorly, the supraspinatus superiorly, the infraspinatus and teres minor posteriorly. In this table, the rotator cuff muscles, they are also known as scapulohumeral muscles because of their attachment to these 2 bones. They are called intrinsic muscles of shoulder joint, and as you are already aware, they are also called sits muscles. In this table, you can see the origin, insertion, nerve supply and action of the rotator cuff muscles. Coming to the subscapularis, which is seen on the anterior aspect of the shoulder, takes origin from the subscapular fossa and it's getting inserted into the lesser tubercle of the humerus. and is supplied by the upper subscapular nerve, and its action is medial rotation and adduction of arm. It strengthens the capsule of shoulder joint and stabilizes it. Coming to the supraspinatus muscle, which takes origin from the medial 2/3 of supraspinous fossa. You can see it in this picture, and it gets inserted into the greater tubercle of humerus in its uppermost part. It is supplied by suprascapular nerve. Its action is, it initiates the first 15 degrees abduction at the shoulder joint, and it also stabilizes the shoulder joint. The infraspinatus muscle takes origin from the infraspinatus fossa on the dorsal aspect of the scapula, and it is inserted into the greater tubercle of the humerus in its middle part. It is supplied by suprascapular nerve. The teres minor, it takes origin from the upper 2/3 of lateral border of the scapula on its dorsal aspect, and its origin is interrupted by circumflex scapular artery. It is inserted into the lowermost impression on the greater tubercle of humerus. It is supplied by axillary nerve. The action of infraspinatus and teres minor are adduction and lateral rotation of arm. They also stabilize the shoulder joint and strengthen it on the posterior aspect. That is about the origin, insertion, nerve supply and actions of the scapulohumeral or sits muscles or rotator cuff muscles. Coming to the clinical importance of the rotator cuff. There is what is known as rotator cuff disorders that can result from supraspinatus tendinopathy and impingement syndrome or painful arc syndrome. So the rotator cuff disorders can be due to supraspinatus tendinopathy or impingement syndrome or painful arc syndrome. Let us see what is supraspinatus tendinopathy. In this supraspinatus tendinopathy, there is limited blood supply to the supraspinatus tendon, which is subjected to repeated trauma and continuous friction that can cause deposition of calcium in the tendon. There will be strain of supraspinatus because of working for a long period with the arms in slight abduction. For example, as in typists who will be working for a longer time with their arms in slight abduction. It will cause distressing pain. The subacromial bursa will be inflamed, causing movements at the shoulder joint being painful. In this picture, you can see the inflammation of the supraspinatus tendon and then the inflammation of the bursa, subacromial bursa. The other condition that can cause rotator cuff disorder is the impingement syndrome or painful arc syndrome. The causes for this condition are osteoarthritic thickening of coracoacromial arch, inflammation of rotator cuff, or prolonged overuse of rotator cuff. Swelling of supraspinatus muscle due to repeated friction. Excessive fluid accumulation in the subacromial bursa. It can also result from bony deformities in the acromion that can lead to impingement on arm abduction. In this condition, there will be pain on shoulder abduction between 60 to 120 degrees, which is known as mid-abduction pain, as the tendons of these rotator cuff muscles are in contact with the acromion, and most commonly involved muscle is the supraspinatus, as it passes in the limited space underneath the acromion, and there is no pain in adducted position, as the lesion is away from the acromion. Initiation of abduction is by tilting the limb to the affected side to overcome the difficulty, and further abduction is by deltoid. So, the supraspinatus is the one that is commonly involved, and it is involved in the initial 15 degrees of abduction. And to begin with, in the initiation of the abduction, it is done by tilting the limb to the affected side to overcome the difficulty. This is about the rotator cuff disorders and about the impingement syndrome. Another condition of clinical importance is the rupture of rotator cuff. The most common tendon that is affected is the supraspinatus tendon, which can rupture partially or completely. In this picture, you can see the rupture of the tendon of the supraspinatus. And this is more common in old person because of degenerative changes with age. The person will be unable to initiate the movement of abduction at the shoulder joint, but will be able to maintain it once the arm is partially abducted. In this condition, even daily activities like combing the hair becomes difficult.